Hi, Dr. Cox here. Wanted to give you a quick training on a couple of different treatment techniques that we use here in the office. And these are a couple of things that are very nice that involve literally no twisting or popping of the joints. Believe it or not, there is a large segment of the population who won't go to a chiropractor or is scared to go to a chiropractor. One, because they've either had a bad experience in the past, or number two, they just don't want to be twisted and popped. They don't want the twisting and popping in the joints. And trust me, I understand. I have had my fair share of bad adjustments in my career. And so that's why I brought into the office two state-of-the-art pieces of equipment. The first one is called an arthrostim. And what's nice about this instrument is it requires literally no twisting, no popping, no rotation of the joints. It works, it's a spring-loaded instrument. It's mechanized, it's electronic, and it vibrates, or it basically impulses at 12 impulses per second. It's way faster than the human hand, and so it's very effective at getting deep into the joints in a very quick manner without any uncomfortable twisting rotation. And we can apply more pressure, and it gives back more pressure. So if I have a big patient laying here, we can use apply the proper amount of pressure. But you've got to be very careful in cases where you have someone who has maybe fibromyalgia. It just hurts everywhere. They don't want to be twisted and popped. You have someone who has severe osteoporosis, maybe a spine fusion, perhaps a disc herniation. You have to be very careful, very mindful the way that you do manual adjusting. We still do manual adjusting in most cases, or in many cases, but we don't have to. Nice thing about the arthrostim and the vibrocussor, which I'm about to show you, is that we don't even have to have a patient laying on the table. They can literally be sitting or standing, so if they just had a recent surgery or it's just too painful to lay down, we can adjust them in standing position or sitting position. It's great. This is called the vibrocussor. This is probably the most popular piece of equipment we have in the office. And what this does, this vibrates at 60 hertz per second, or 60 hertz cycle. And what this does, most massagers will vibrate in either one of two directions, front to back or side to side. This one actually does both. It's like a random orbit sander, so it gets deep into the tissues. It's very effective at loosening up scar tissue, fibrous adhesions, muscle spasms, and it works fantastic. And again, these are two nice therapies that we can use in addition to or in place of the manual adjusting, and they work very well.